Good morning, Sonoma County. I'm Susan Gorin, Chair of the Sonoma County Board of Supervisors. And thanks for tuning in today on Take 5 with Susan. It's my pleasure to interview once again Dr. Sundari Mase, our Public Health Officer. And boy, do we have a lot of questions for her. The community has a lot of questions for her. So let's start with question number 1, contact tracing. Everybody wants to know what that is all about, and really, how does it help us move forward through the pandemic?
Yeah, thank you so much, Supervisor Gorin. Great to be with you as usual. Well, contact tracing is really important. It's an important way to prevent the spread of COVID-19. It begins by county health department staff reaching out to individuals who are diagnosed with COVID-19 and asking them questions to help identify everyone with whom they had close contact during the time they may have been contagious. Health department staff then notify these identified contacts about their potential exposure to someone with COVID-19, but they do not share the identity of the infected person. During this phone call, contacts receive information about COVID-19 symptoms and a referral for free testing to occur 7 days from the date of exposure for those not experiencing symptoms, and right away for those who are symptomatic. Contacts also are instructed to self-quarantine to prevent further spread of the disease. During the quarantine, the contact may receive a daily phone call from the health department staff who ask if they're experiencing any symptoms. And sometimes we actually test as late as 10 to 12 days from date of exposure to increase the likelihood of ensuring that we diagnose COVID in that contact.
Can you tell us why contact tracing is so anxiety-ridden for members of the community? They must have some resistance, but why is it important that they participate in this?
Well, let me just first say that contact tracing is a proven tool that has been used effectively by public health professionals around the globe for several hundred years to help limit the spread of highly infectious diseases. Tuberculosis is a perfect example of one of these diseases. We're learning more and more about the novel coronavirus each day, including how people may be infected with COVID-19, but they can still have no symptoms and be contagious. That's why it's so important for local residents to participate in the contact tracing process. You may have been in the presence of someone diagnosed with COVID-19, be unaware of your exposure, and possibly be unknowingly spreading the virus to family, friends, coworkers, and the broader community. By learning of your potential exposure status and separating yourself from others until you know for certain if you have COVID-19, you're doing your part as a responsible county resident to reduce the spread of a disease for which we do not have a vaccine or a cure.
So we're so nervous when we get a phone call asking for information. What will the health department ask and what wouldn't they ask? How can the receiver know that this isn't just another scam?
Yeah, that's actually a valid concern, but I want to tell you that if you're named as a person exposed to someone with COVID-19, that is, you meet the definition of someone with close contact, health department staff will call you and ask questions to help determine your possible risk for becoming ill. You'll be asked to help identify where you've been, such as work and places you frequently visit, to describe your living situation and your health status, including whether you have symptoms suggestive of COVID-19 illness, and to share information about how to reach you. The health department will not ask you for your social security number, for your legal status, or for money for testing or for treatment. And information will be in good hands and not shared with anybody else.
So is this process safe for immigrant communities or other communities of color who don't usually engage with the government?
I assure you that the health department will keep your information strictly confidential and will not share it with immigration officials or other agencies. You may be confident about this assurance due to our strict compliance with and enforcement of the health information privacy rules, such as HIPAA laws, confidentiality agreements signed by all county staff, and processes and systems that we have in place for securing and storing confidential information. We also will not share your identity with any contacts you have identified. Finally, if you're concerned about your ability to quarantine or isolate at home, we'll connect you with local resources, including housing, food, and domestic violence and economic support.
So how is contact tracing impacted by the delays in test results? We're getting nervous that our test results are increasingly delayed and longer. And what is the county effectively doing to respond to those delays?
Well, the health department staff can't start informing individuals of a possible exposure until they receive notification of a positive test result representing infection, and then interview the infected person to learn the names of his or her contacts. Delays in testing in the laboratory, obtaining test results, and in the lab reporting those results is a serious problem. The more delays that occur in any part of this process ultimately delay the contact investigation and increase the possibility of more COVID-19 transmission. Health Department has taken several important steps to overcome the problems associated with delays in the testing and result notification process. First, we've ordered new equipment that will greatly improve our laboratory's ability to process more tests. Second, Health Department has hired more staff to shorten the time between receiving the report of a positive result and conducting an interview with the COVID-19 infected person, thus reducing the time until contacts are named and tested. We also have hired additional staff to keep our lab operating for longer hours. Third, the Health Department has contracted with private labs to enhance our ability to handle any unexpected sharp increases in testing demand. Our lab has a really good turnaround time and can assure that we get test results in the quickest fashion so that we can do the contact tracing as soon as possible.
Dr. Mase, thank you once again for joining us this morning and talking to the community about the challenges that we are experiencing. Thank you for your time and your hard work. And on behalf of a very grateful community, please thank all of the staff who are working so tirelessly. And thanks to our residents for tuning in on this interview. For more information about COVID-19, please visit socoemergency.org or call your information hotline 211. See you next time.